What other questions you have?
Um, Another question I also had, kind of like what happens if you quit cold turkey? Like, what is the consequences of that?
Yeah, so it, I guess I want to qualify that not, this is not for everyone. So for people, and it's different levels for different people. So some people can drink a whole bunch and it's not a big deal when they quit drinking. Other people uh I guess what I mean is different thresholds, right? So what can happen is you can have seizures, we're called alcohol withdrawal seizures, and get delirium tremens is another. It's a condition of alcohol withdrawal, where basically the receptors in the body are like devoid of the alcohol, and they kind of freak out, I guess is the way to say it. So in the first like 3 to 4 days after someone quits drinking, cold turkey, when they drink excessively before, you have to kind of medically watch them. So someone who's had it before, like if you had when you quit drinking or you stopped drinking for a period of time, you've had a seizure, you we consider that like high risk, and so if they ever were to quit drinking again, we would say you need to be hospitalized actually when you're coming down from it. We need to supplement your receptors with actually a medicine that's similar to alcohol, but then we can control it, and slowly titrate them down on the medicine, until their withdrawal is over. So it's alcohol withdrawal is a very serious and life-threatening condition.
Yeah,
Um,
I mean, that's actually because obviously like you see in movies, people detoxing and whatnot, but not like obviously true life, like how serious that can be. And I never knew that actually, how dangerous that is.
Yeah, yeah, and I think I don't know if this is exactly right, but I think Amy Winehouse was actually a kind of a famous example where she's a singer in case you guys don't know that, but she quit drinking, and she didn't have support, and she just kind of quit, and she actually died. It can be fatal. So um uh and I've seen it in patients as young as like in their 20s and 30s. So it's terrible to see. And usually, the other kind of thing not even mentioned, there's a lot of personal consequence, right? And it could be fatal, and you can have seizures, you can have liver failure, all this stuff. But just you can see the family, if the family is still around, because in later as years go on, a lot of alcoholism is a very selfish disease. It's terrible to say that, but it becomes, because the person becomes so fixated on their alcohol use and the addiction, that they and I remind people it's a disease, right? So your brother, your sister, your mom, your dad is under there, but the disease has taken hold, and it can be they can do things that really just can upset family members and friends and burn bridges. And so, in people who are younger, you see that family's still around, and they're just hitting their head against the wall trying to help them, and without enabling them. And then unfortunately, as a person gets older and has had this for longer and longer, and so I'll have patients withdrawing who are in their like 30s, and then I'll have patients withdrawing who are in their 50s and 60s. And you'll notice those people in their 50s and 60s don't have as much support around them, because they've burned all those bridges, and their family members have completely given up, because it's such a terrible disease. And having it in my Ducharme Smith family, before, and seen it, and it's, you have to remind yourself that it's a selfish disease. It really is hard, and they're not themselves. They're not making decisions like your loved, uncle, for instance. They're the disease is really kind of nasty in that way.
So, obviously, you would not suggest quitting cold turkey, so what are some other ways, like other treatment options that you suggest to like help with?
So that's a great question. I think the first thing that I always tell people is go to your, not everyone has a doctor, but you should. Should have a primary care doctor. Obviously, I have that bias since I am a primary care doctor. But I say, if you are concerned about your drinking, and anyone who's drinking, they know of a time when they have a day or two that they're not drinking, and they know how they feel, right? We know about hangovers, right? But there are people, you can ask them, so how are your hangovers? How bad are they? And if you ask people that, people say, it feels awful, feel rotten. And then there'll be some people who say, actually, I got pretty scared once when that happened, and so I never let myself go a day without drinking because I got really scared with it. And I tell people, if you feel like your hangovers are really severe, you're having a lot of symptoms, or if you feel like you're scared to stop drinking, that's a good sign that you need to go to your doctor and talk to them about it. And there are medicines we can help use to help you safely stop. Um, there are medicines in the category where they can help you, you know, so there's two issues, right? There's alcohol withdrawal, right? That's a big issue. And the other issue is the addiction part. So how do you combat both of them? So we can use medicines to help both, like to help the addiction part, so you don't feel like you're as needing of it, as addicted to it as necessary. And then the withdrawal part, there's medicines to help you so that you can safely withdraw from it too. Um, and you really frankly need to use medicines to do that. It's really hard without medicines to quit. If you're kind of have alcohol, if you're in the alcohol use disorder category.
Is rehab also still a thing that people do, or like that doctors recommend a lot or no?
Oh, of course. Yes, of course. You're absolutely right, Harper. Yeah. So rehab is another one because so rehab can be all sorts of levels. You could do day rehab where you just kind of there, at a place for the day, and you can do, staying, in a facility the whole time kind of rehab. Or there's some where you just kind of meet with a therapist once a day for an hour or two. There's all sorts, it runs the gambit, and it really there's uh there's different facilities and different resources in the community for that. So yes, rehab is definitely still part of it. And I think once you have like really severe alcohol withdrawal, and you've been hospitalized for it, you basically can't stop drinking alcohol without doing some form of rehab. Some people earlier on, in the case who might be drinking, and it's kind of unhealthy use, you can do it without rehab. But I think rehab is really beneficial, whether fully inpatient stay, like you're there the whole time, or just a day program, or just for a couple hours a day. It really can help you. And why it helps you is you are monitored more. So you have people to help, you also have therapists, because again, it's addiction is a psychological, thing, and they can help you talk through it. And then you have support that you might not have at home. You have, peers who are in this with you, and you have support from people who are, trained and professionals in this, and they can help as well. So that's why rehab is so beneficial and frankly necessary.
Right. Yeah. Another thing I was also kind of curious about going off treatment is like, because obviously one of the symptoms is depression and like how dangerous that can become, with suicidal thoughts and tendencies. I was kind of curious about that.
Yeah. So this is a great question and a great kind of category. Sometimes I have to sort out with people if their drinking is more cause of the depression, or if depression is just, a secondary thing. And a lot of times the depression is actually primary, right? And you realize the person became drinking on, had a more unhealthy drinking habit because they were using it to treat their depression. They're using alcohol to treat the depression. They're using a substance of any substance really, but alcohol is the most common, to treat their depression or their anxiety. So you might have heard this from kind of famous celebrities who've kind of quit their drinking. When I stopped drinking, I had to face myself in the mirror, because for the first time they can't just drink away, their depression or their troubles. They had to actually face that person in the mirror and kind of come to terms with it. And so I often, have to sort out which kind of, which mental health issue is kind of primary, and know how to do that. And sometimes you have to start with an antidepressant, because you're never going to be able to get someone off of drinking if that's their treatment for depression, unless you come up with another alternative. Or that's another thing where rehab or even therapy once a week, or a couple times a week can help as well. Yeah, it's a good question. And I think too, another thing I see is I'm so inspired by your generation, because I think you guys have a better understanding of mental health, and better understanding of talking about that, and talking about emotions, talking about these things, and it's not taboo. A lot of older generations, it was so taboo, and to even be considered depression. Like if I say it into my 70-year-old men, for instance, I talk about depression, they're like, nah, doc, don't talk to me about that. They really frankly will not even let me go past that, even though they have every symptom under the sun to say they're depressed. They won't even let me say that word. And so they a lot of times turn to alcohol, right? Because that was socially acceptable to drink. That's socially acceptable to do. But to take an antidepressant or talk to a therapist, whoa, no, that's not socially acceptable. I will not, and and I think I'm hopeful for the younger generations that it's a lot more commonplace and a lot more acceptable, and it's less of a stigma to go to therapy, to take a medicine. And the COVID pandemic was terrible for a lot of reasons, but it was good for some. The silver lining for that is I think it kind of brought that to the forefront, and it kind of made our society have a reckoning with it, to realize, look, this was a very depressing time. We were all stuck at home, and we had to face ourselves in the mirror and all that stuff. And so I even noticed like a huge increase in mental health referrals and therapy referrals after the pandemic.
Yeah, that's yeah, that makes sense for sure. I had never really thought about obviously having to discern the difference between if someone is an alcoholic or just dealing with their problems through alcohol, because I feel like that could be a thin line, to try and
Totally. And it become so comorbid that at a certain point they're both there, right? But unless you understand or address the ones that are playing in, you're not going to get anywhere with alcoholism. You're not going to get anywhere with the depression unless you kind of tackle them both, or tackle the one that's the primary. So you're absolutely right. Yeah.
Right. Also, Emerson, if you have any questions asked right now, I need to grab a charger, otherwise my computer. I will be right back.
I would, yeah, I guess just the like self-medicating of the like mental health, and there was one of my questions was going to be how does it relate to mental health, and like that answers it is just like the self-medicating part. Um I guess another one of my questions would be is oh no, I'm blanking on it. No, come back. Uh,
No, you're back. Don't worry. It's always
so okay, no, so you so there's obviously like supportive family and people who like care for the people and like want to help them, and then there's people that like don't necessarily have that support, and like where like does the um oh, how do I want to phrase this? I'm not sure. So where
How
um
can family member
who,
help?
who
Or
yeah, so like people who are like seeking help but don't necessarily have that like supportive family, how do they go, or like how can they like reach out and find help if they don't like have a primary doctor? Like how do they go about like finding that help?
that's a really great question. And there's several things. If they have a doctor reaching out to their clinic, right? I live in Rochester. Mayo Clinic is supreme here, right? We have a lot of resources. So, people in around this town and in the health systems, they can reach out to the clinic, right? And ask for help that way. That's one route and if you feel comfortable doing that. Other routes, there are a lot of community resources, and so AA, Alcoholics Anonymous, is a really great organization that has a lot of success. And I've been to AA meetings with patients before and to see what it's like. And there's kind of a religious overtone to it, and so but I even hear from patients who are not religious, they find it very helpful. So whether you're religious or not, that's a helpful group, and it's great because you get set up with a sponsor or a mentor kind of person who's been through this, who's further along in their sobriety than you, and they can help you, and they've been through it, so you have that lived experience, which really helps. And then you have you're in the group with people who also suffer from alcoholism, again at different stages, so you can kind of lean on each other. So AA is when you can just Google that and find that in any city you're in. And then there is this great website that I use so commonly for all sorts of things in my practice called findhelp.com. And for anything, if you need help with finding groceries, or you need help finding food pantries, or you need help finding clothes for your kids, or transportation, or mental health, all of it you can find at findhelp.com. Another name is Aunt Bertha. Some people have heard of, but So those are community resources. And then, you know, any of your public health department websites, it's on there. There's something called a needs assessment that communities do. It's like public health, right? Part of public health is like how can we, as a community, care for all of each other. And a lot of needs assessments in the last few years have been about mental health and about substance use. So they compile on their websites resources in the community. I could probably really easily look it up for you guys in La Crosse, just to kind of give you a sense of it. Those are kind of some ways to look up resources for this. And even if you don't know if you have a problem, if you're wondering if you have a problem or you've heard about it or you're worried about a family member, I think AA or your primary care provider is a really good place to start with asking this question.
That's actually, I mean, that's kind of good to know because I feel like, again, like in movies and shows, you know, you hear about AA or people dealing with alcoholism, but like how like actually helpful it is. So it's good to know that they're actually, you know, that it is really doing something and helping those, which is, you know, very important.
Yeah, and I think there's also you have to recognize too, as a person, like you're at different stages of your life, you're at different stages of your acceptance of understanding you have an issue, in different stages of like ready to change, like we talked about before, whether you're pre-contemplative or contemplative or ready to change, all these things. So I have found, like, especially, it can be really hard to take care of these patients over their lives as their primary care doctor, and let alone being a family member of that, right? So I found, like, I've had conversations with patients, and I've been in practice like 8 years. Okay, so I remember having a conversation with a young guy, and I was like, look, this is like when I first started out, and I was green as can be, and I was like, I think you're drinking too much. You think you're drinking too much? Like, nah, I'm fine. Everything's fine. And over these last 8 years, you know, as he's grown up, as I've grown up, you know, and he's starting to have more negative consequences of it, you know, he's told me before, like, look, I wasn't ready to hear it before, but knowing that you had said it, put the seed in my head. And, you know, you had told me about AA at one of our times, like a couple years in, and I thought you were crazy. And I went to it, and this is the dumbest thing in the world. And you know what, Doc, last week I went to an AA meeting again after, you know, not doing it for 6 years. And that was the time. Like I felt like, you know, this was the place for me. This is where I'm gonna, you know, kind of work on it. And he's had a couple of relapses, pretty big ones. But he's different than he was 8 years ago. He's different stage of his readiness in AA. You know, you have to meet him at, you know, at the right time. And sometimes it's the right time, sometimes it's not. So yeah, it can be really helpful. And especially I found a lot in my older patients, like 40, 50, 60, I found a lot of help with it. But I think that's the reason it doesn't help my 30-year-old as much is because they're not ready.
Right. I was also kind of backtracking a little bit when we were talking about meds, you know, some of the older generations, they're obviously like there's more stigmatism towards like, you know, mental health and like if you are genuinely depressed and whatnot. And is it kind of difficult or do you experience a lot of people saying like, no, like I don't want to be on meds, like I don't want to have to be dependent on them because like I
Yeah.
feel like yeah, there's like a big stigmatism also around medication and I feel like that's kind of hard to be like these people genuinely do need it.
It's such a great point. And everyone's different. So you have like everyone that you can have a preconceived notion. Like I've talked to them. Like, I have a lot of farmers on my panel, and you know who are in their 80s, and they work the land for their livelihood for years and years, and like, you know, I'll be damned, they can take care of this too, you know. And so I'll come at there's several times where I've come at them like, okay, they're gonna say no, and they're gonna hate it. They're not gonna like meds. They think and then like I'll I'll be surprised by their answer, you know? So I come at it like non-judgmentally. I'm like, I ask them, I tell them what I would recommend. And, you know, for instance, if I think they need medicine for their mood or for alcohol use disorder. And if they say no, I say, okay, take me through what you're thinking about this. Like, what is it that is making you say no? Because I don't know. Like, I make assumptions, you know, and you do, you naturally do as a human, but you know, I don't know unless, you know, and I think that way you can reach people. Like maybe you'd be surprised and they say no because they're worried about side effects. And then you have a whole discussion about side effects. Actually, you don't have to worry. Or maybe they say no because their brother's sister's aunt took a medicine and they, you know, it was negative a thing for them. They got worse. Or maybe they say no because they don't want their I had one where they didn't want their wife to know they were taking a medicine because they were worried what the wife would think. And then when we brought the wife in there, she's like, "I wanted you on a medicine for 50 years," you know? So like it's really helpful to have fun about it. Um to to talk, you know, with your patient and talk with people and even in your families and have a conversation about it. Because you'd be surprised. There are certainly stereotypes, right? And so like my older people, they in general, a lot of times they are scared of meds. They don't, there's concerns about weight gain with medications for depression. There's concerns about sexual side effects like low libido and things, which really we can manage and we can talk through and we can figure out the right, you know, issue for and right combo for to help. And so just educating my patients about that we have options um, is really helpful. I'm sorry, I can blabble on for days in case you can't tell.
No, you're totally fine. All this information is actually really helpful. I think will be helpful for, you know, anyone who hears or sees it. So it's good. Thank you. Emerson, do you have any other questions you'd like to ask?
Um, I don't have any other questions. I just have a lot to reflect on all this like new information. Because I feel like a lot you hear about like what vaping does to you and like what drugs do to you, and that you never really hear about like the alcohol part of it because it's been around for so long that like drugs are new and like vaping's new, and so like people always educate you in schools and like at your doctor's appointments and like don't vape and don't do drugs, but I feel like you never really hear like the side effects of like alcohol, and that like alcoholism is a disease, and like just like any other like drug or vape, like you can get addicted to it. And so I think just like coming to like terms with that is like really good, especially for the younger generations coming in who won't necessarily hear that speech so much as they would vaping. So
Yeah, and that's a really good point, Emerson. Like I remember being in your shoes like ages ago, and I remember they had someone on the I don't mean to laugh, but they had like someone come talk to us about the dangers of heroin. And like they're like, I did it once and I was addicted for life. And like that was like my take home from it. And he gave a speech in front of the whole school, and we are all like, you know, we didn't want to listen to it or hear it. And so I don't mind, you know, in talking about alcoholism and things, I want to be sure to say it's not like if you drink alcohol or you drink excessively one time or you know two times that you're destined for liver failure and things like this, but it's just being reflective of what you do, what you consume, how you're consuming, why you're consuming, and understanding that there can be unhealthy behaviors and the mechanism of alcohol can be dangerous if you know if you're doing it in excess and doing it for the wrong reasons for a long period of time. And so um uh just being cognizant of that and understanding why you do what you do and or are you doing it because there's a social pressure and everyone around you is doing it and you really feel you need to? Are you doing it because you're depressed and you don't know how to handle that? Are you doing it because everyone you know is binge drinking and if you don't black out you're not part, you know, you don't feel like you're included, and there's a lot of different reasons to be doing this. So just being reflective about your what you do, because telling you to never drink alcohol because you're, you know, is really not is not even how alcohol is in our society and things. But just understanding, do you have a family history? Are you predisposed to it? Like, is that something that's a problem in your family? Maybe you need to think about through that, or all those things. It's just being aware, I guess, is the take home.
Awesome.
yeah.
I mean, yeah, I don't have anything else to add. I really appreciate you coming to speak with us, Dr. Smith, and everything, and all of this information has been really helpful. And I definitely, my notes are kind of all over the place, but I've learned a lot, and I think that it was just really good information. And I appreciate you spending your time.
Oh, of course. It's great to talk to you guys. And thanks for handling the screaming children. So, any other questions, anytime, email me or text me anytime. I'm happy to talk. Or if you have follow up questions or if friends have follow up questions, honestly, text me. If you're concerned about a friend, text me and I'll call them and I'll see how they're doing.
Yeah.
Awesome. All right, guys. Have a good night.